a little frustrating that there's 150, 160,000 major amputations a year, and half of them are from vascular disease.
Just last night, I had a patient that called our hotline, and her mom was told by their hospital that there was nothing they could do. They could not treat small vessels below the knee, which we just proved in the first segment that it is possible.
If you have a wire and you can get through the blockage and you have a balloon, you can open it up and, does it last forever? No, but typically it's enough to help with wound healing and help prevent a little, a minor amputation, major amputation.
Hey everyone, welcome to the show. Today we're talking about the extent to which physicians across the globe save life and limb. Because Dr. John and I just recently returned from a prestigious conference in Venice, Italy. It was so fun, Dr. John. There were a lot of great cases. It was the 10-year anniversary of Mariano Polania and Marco Monzi and their incredible conference. I know it's something that's special for you to attend every year and actually be on podium.
Click is always fun. I like going over there. I mean, you can't complain. You're in Venice, but it was busy because there was a lot of you have responsibility there, and you learn a lot. You get to as we were talking before we went live. It's just cool to see people from all over Europe
Everywhere.
that you don't see in the U.S. I met a couple physicians from the Ukraine, Romania, Egypt, Singapore. I mean, everywhere. It's a special place and time. Yeah, I'm always very grateful to Marco for allowing me to spend a week over there in 2014, and that's where I really learned how to do a lot of tibial work, which is the plumbing, fixing the plumbing below the knee. Really critical if you're going to help people with chronic limb-threatening ischemia, the kind of the deadliest version of P.A.D. So you always learn something. You eat some pretty good food too, and
I know.
drink a little.
Really, really good food.
And I was the cool thing about Italy is their table wine is typically better than our expensive wine, so it's a
And they
lot
don't
cheaper.
have all of the pesticides that we use here.
Yeah, 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 definitely. I mean, they're a thinner country, I think. Europe is typically they smoke a little bit more, I think, than we do, but you walk everywhere, right? But you
We
and I,
do.
we kind of were like two ships in the night. We saw each other a little bit, but you were getting pulled, I was getting pulled, and it'll be fun to kind of reconnect. I'm interested to see how you interpreted the conference and what you were able to glean from it as well.
It was incredible. And what I loved also was our sponsor, big shout out to Reflow Medical. They have the retractable scent. I had an opportunity to sit down with Dejan, who's part of the marketing team, and he's out of Europe. And it was great to be able to reconnect with him. And again, thank you to them for keeping us afloat and allowing us to continue to educate not only the San Francisco Bay Area, but folks across the world that watch us online, as well as here on the radio on KDOW. And we also, this was really cool for me. And I know my dad's listening in right now. One of the highlights for us was we arrived over at the Hampton at the hotel near where the conference was being held. And one of the doctors from Romania walks right up to me. I'd never seen him before. And he says, "Hey, Kim McNicholas, how you doing? I've been wanting to meet you." Got to be kidding me. So a doctor from a private hospital in Romania. And he said, "Yeah, our marketing department told me specifically, and they showed me your picture and said, I needed to come find you to talk about the Global PAD Association's walking program. We want to implement it here." So while I was there, I was on the phone with my developer and integrating Romania into our system so that they could launch our walking program there. So that was
I
one
mean,
of the highlights for me.
no, that's awesome because it certainly reinforces what you're doing, which is good, right? And if we have a time for a quote, I've got one that kind of
Yes.
highlights that as well. But yeah, it's got to feel pretty good. But I mean, at the end of the day, I think you don't do what you do to be praised. You do it it's so praiseworthy. So like you're doing virtuous things, and from that, people will recognize them and hopefully learn from what you're able to do and raise awareness and educate folks. I mean, we were talking about amputation rates not too long ago, and it's still a little frustrating that there's 150, 160,000 major amputations a year, and half of them are from vascular disease. So we have a lot of work to do, you and I.
We do. And I had good news this week. Senator Daschle's office reached out, and I'm going to be speaking on Capitol Hill on May 13th in partnership with Neuros Medical. Remember, Neuros Medical was
Yeah,
recently on our show, and they
yeah, yeah,
have,
yeah, yeah. Wow.
right, they have that solution for amputees that continue to experience pain after the amputation, well, with their poor circulation in the legs, we call PAD. And they have an opportunity to do a roundtable with Senator Daschle, and they asked me to come to talk about life for PAD patients and life for PAD amputees. So, really excited about that
Wow.
opportunity
Very,
and to express exactly what you said, that most of these amputations are unnecessary, especially with early diagnosis, but also doctors such as yourself that exhaust all efforts with advanced tools and techniques to save life and limb. Now, the one
yeah.
thing, Dr. John, what I love about going to this conference is doctors here say, okay, well, we can't do it because we don't have this device or that device. They have magic with wires and balloons, right?
Hmm. Yeah, yeah, no, I mean, I think that that is one thing that you learn because their health system is much different than ours, and they are not like they're not afforded the opportunity to use a lot of the equipment that we use, and I think the equipment that we use is beneficial, but sometimes it might be a little overkill. And if you have a wire and you can get through the blockage and you have a balloon, you can open it up and, does it last forever? No, but typically it's enough to help with wound healing and help prevent a little, a minor amputation, major amputation, and, save my piggies, which is really what we're all looking to do here. At least I am. So it's a good conference. Very good
And
conference.
one thing I saw there that I had never seen before is a doctor. We talk about a doctor going through the groin to try and get through a blockage, what we call an antegrade approach or going south. But we also have the retrograde approach. And I've seen people go through the foot, I've seen them go through the calf or behind the knee and access the artery there and tackle a blockage coming up from below. But I had never seen a doctor go between the big toe and the second toe before. Now, this is something that before the show you said you even just did.
Yeah, I mean it's
That's incredible.
well, so we use a needle that's 21 gauge, so it's pretty small. It's about the diameter actually of those arteries, and so you can. The interesting thing too is those arteries, they have to be pretty calcified, or at least to have a kind of a core of calcium around them, so they're stable, and you can kind of poke into it, and then that stabilizes the needle, and you can get a little wire in there to kind of hopefully get where you need to go. Yeah, I
Yeah.
did that this after or yeah,
Wow.
2 days ago. So it was fun. It was fun.
Wow. I'm so impressed. I mean, it makes me just wonder how it is that doctors can still say it's not possible to treat any vessels below the knee and never even try coming up from below. So, coming up next, right here on the Heart of Innovation, we're going to hear more the extent to which doctors go to not only save legs, but also lives, including our Dr. John Phillips. So, stay with us. You don't want to miss what's coming up next.
How many procedures are you willing to go through? Is it worth going through that many, or would you rather just
That's funny. Was it worth it? Oh yeah, I have my leg, man.
Amputation should absolutely, positively, 100% never be a first-line treatment.
What an incredible operation, what an incredible lab you have here. Without a doubt, we're underdiagnosing peripheral arterial disease. It has not gotten the attention that it should because it is a killing disease, it is a disabling disease, and most importantly, it's a disease that we now have great treatments for. Okay, let's go to the next one.
They were going to amputate it, and I needed to consult with my family. Did I want it off here or here? You're just shocked. It's scary. I mean, I don't even know how to explain it. You're 42 years old.
We're waiting till people are at the end of the spectrum and almost beyond hope. There is good care available here. Closed minds are what we have to get rid of.
Welcome back to the Heart of Innovation. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips. Dr. John Phillips' spectacular vascular moment of inspiration.
So lately, I've been on an Adam Smith kick. So I don't know if y'all know who Adam Smith was. He was an economist and philosopher in the 1700s. Wrote several books that have continued to like shape how we think about capitalism and free market economies and things. But he also just kind of is a thoughtful person about like thinking, and he basically he alludes to what I had said about what you were doing, Kim, like for the greater good. And so I kind of like this quote. So this is from his book, The Theory of Moral Sentiments. He's quoted as saying, "The wise and virtuous man is at all times willing that his own private interest should be yielded to the public interest." Meaning, don't be selfish, right? Be virtuous, benevolent, take care of other people. That's the right thing to do. And that's kind of what you were alluding to, and you should share it with the live audience, right? About this weekend, trying to help that person who clearly had some issues with vascular flow and was potentially have a threatened leg that needs some help. And sounds like hopefully you got them to the right place, and maybe they can get to have the piggies saved.
You know, we these doctors that are critical limb ischemia doctors like yourself that are truly, I mean, you can exhaust all efforts to save life and limb, and that's wonderful. But the true CLI operators, they're almost 24/7. You know this
Yeah.
as well. It just doesn't shut off. And just last night, I had a patient that called our hotline, and her mom was told by their hospital that there was nothing they could do. They could not treat small vessels below the knee, which we just proved in the first segment that it is possible in many patients to actually treat those small vessels below the knee and even come up through the foot and even between the toes to access the arteries. And the three top doctors in Boston that I'm connected with, Dr. Eric Szymski, Dr. Anita Dua, Dr. Matthew Maynard, they were at another prestigious conference called Charing Cross in London. And so they had not gotten on a plane to come home yet. And it was 10 to 10:30 at night over there in London. And all three of them responded to my pleas for help that this patient and their daughter and her husband were all sitting in the car trying to figure out what emergency room they were going to go to because the hospital they originally went to was going to cut off her leg. And they just wanted someone to at least try to save the leg. And so I said to Anita, I said, hey, could you, should we send her to Mass General? I said to Eric Szymski, should we send her to Beth Israel or to Matthew Maynard? Matthew Maynard responded first. And he said, no worries. In fact, he was in Copenhagen at the time. And I'm talking, this is above and beyond the call of duty. This is their own time. They're traveling. They're beyond the conference. They're now with family, trying to have a good time. And I think in his case, I think I even woke him up from a sound sleep, not just once, but twice. And he was so kind and ended up facilitating emergency room care for this patient, talked to his team, put his name down as the supervising physician, asked them to do all the tests, and that he plans to take care of her personally on Monday.
Great.
But
Yeah.
Anita Dua and Eric Szymski were all willing to do the same.
Yeah.
And that blows my mind. That is true selflessness. That's beyond the call of duty. And that's exactly what your quote was addressing.
Yeah. Again, I think if we all were nicer to each other and took better care of each other, the world would be a better place. And so as a physician, and again, like this is just me and how I interpret it, but there's certain limitations to what you're able to do. But honestly, when you call or text or whatnot, and anybody does it, it's a quick phone call oftentimes, and we have a transfer center, we get them transferred in, boom, and then the rest kind of falls into place. But you just have to be willing to walk through the door, or I guess open the door for these folks. But this patient probably, it sounds like, would have lost their leg, and they still may, unfortunately. But at least you are giving them a chance, because it sounds like they didn't know where else to turn. So kudos to the selflessness of you and the team.
And also, we're not going to leave you out, but it's not just about legs, it's about lives. And I remember on Christmas, you shared a Christmas miracle with
Yeah.
us. You went
Mhm.
above and beyond the call of duty, and you were recognized recently by local media. And I think our producer, Chris D, you want to run that tape?
Only on 4, a man who had a massive heart attack just before Christmas reunites with the medical team that saved his life.
The team of doctors calls Mark Lamont their Christmas miracle. In December, he came inside from shoveling snow when he felt a strain in his chest while his wife and son called 911. He said after the EMS crews arrived, everything went black. Lamont says he later learned the defibrillator was used on him 40 times to keep him alive. He left the hospital and went to a rehab facility Christmas Day.
An event today reunited Mark and his family with the team who brought him back to life at Riverside Methodist Hospital.
The nurses, the doctors, the technicians, they all did their job, and that's the only reason I'm here. I mean, the miracle is them, that they produced it.
This is truly inspiring for everybody, and it makes us feel pretty good that we can pull together as a team and meet the person that it was basically the reason why we're here. And so Mark, I know he's there to help his family, and I told him, like, the good Lord has some other plans for you.
Here's the ironic part. Lamont told us that he had an appointment with his cardiologist just before this event.
Wow.
Says he feels fantastic. Both his EKG and echocardiogram are perfect.
Do you want me to comment on this, Kim?
Yes.
Yeah, so there's a handful of cases that you will never forget, I think, and this is one of them. And I kind of made a joke when we were talking about Mark. I introduced him to the group, and I said, and maybe I've said this before, but I said, have you ever seen the movie Princess Bride? And everybody's like, yeah. And I said, remember that part where Billy Crystal's with the guy that he said he's only partially dead and he's trying to blow air into his mouth? I said, Mark, you were totally dead, right? And you try to make light of these things sometimes because it's hard to wrap your mind around it. At least it is for me. But the thing that I kind of I struggled with, and sometimes to this day also struggle with, is the fact that I could have it was only me, or excuse me, it was my my decision whether or not he lived or died, and that has been very strange to me because I could have. I remember the emergency room physician said to me, this is all I got. There's nothing I can do here. And as the machine's pumping on his chest, the Lucas device doing the CPR, and we were shocking, and like, there's nothing else. And I could have just said, we're done. And like, that is on me. Like, I would have put truly the nail in his coffin. Like, and I struggle with that because I think I shouldn't have that capability, but we do have it sometimes because it is what it is. It's the nature of the beast. So we certainly chose to do something different, and it worked out. And the other the sad part about it is a month before that, I had a similar case where we did this. The patient survived, he survived long enough, but didn't survive to get what he needed, which was ultimately what's called an LVAD. He needed a device to actually be his heart outside his body, and he didn't survive that. And then the month before that one, another patient woke up after an event, but just had too many other issues, and he didn't survive. So you're not doing well making these decisions. And then we made the decision for Mark, and he survived. And we'll get him on the show, and he'll share some other candid thoughts because he was very emotional when he was talking to our team, and you could just see how thankful he was. And we don't often see that. I mean, the patients come back after they come and see us in the office, and yeah, hey, how you doing? Great. But we never really hear what went through their minds. And then you see his son and his wife and how much it meant to them. And it's just one of those things where, okay, this is why we do this, right? Every time you help somebody keep their leg or get them to a doc that's going to help them, that's why you do it. And it's for events like this, which is why we do what we do. So thank you for sharing that with the team.
The thing is that standard protocol, I mean, you would be following it whether you did what you did or not. I mean, you do your best, but you went above and beyond. I mean, with the choices that you made there, but even taking a step back prior to leading up to, you had a choice. You had forgotten your computer. The only reason you were on call but you could have gotten your computer, gone home, and waited for the call, waited to see if he was stable, waited to be called in to perform the intervention when they were ready. But you decided, for whatever reason, you know what? I just feel something about this. I'm just going to go all the way in. I'm going to be there. I want to be on the front line here and be a part of the decision-making team. I'm not just going to sit back here and wait. And I think that that's huge.
And I call it serendipity or whatever word you want to use. But again, you're right. I forgot my computer. I could have left it there and just picked it up later or the next day because it was a Sunday. And I, for whatever reason, drove back into the hospital. And normally when we get the alert that something's going on, the emergency room calls us and says, hey, this is what's going on. So when we don't get a phone call, oftentimes the patient's not doing well. And then, we're kind of like, okay, well, I'll wait to hear from you. And he probably would have, if I hadn't been there, they probably would have said, he's dead. And so again, I was at the hospital. I'm just kind of like, well, I'm going to go down to the emergency room and see what's going on. And that's when we got the ball rolling. So again, it's a story that I'll never forget, and I share it. But there is emotion involved in it for all of us. Yeah. And so again, when we can get him on the show, he'll share it. And he's just the nicest guy too, like in selfless. And let me just put this plug in for exercising. Okay. He's alive because he exercised regularly. If he would have been sedentary, the guy was shoveling snow, for crying out loud, but if he would have been sedentary or, overweight, whatever it is, like he probably would not have survived. So another plug for get your exercise in, 150 minutes a week. So that's 30 minutes 5 times a day. There's 5 times a week. So exercise, please.
Hey, if you can do it 5 times a day, even better.
That's even better too. Right. Exactly.
But you preach the choir. We have a weekly Collateral Nation walking group meets, and we have Kevin Thomas Morgan, who's been on the show. He's a P.A.D. patient. He also has had a stent in an aortic aneurysm in his aorta, right? And he recently had a heart attack, and he ended up with a quadruple bypass. And the doctor said, oh my gosh, if you hadn't been exercising, you probably, 1, would have died a lot sooner. And number 2, wouldn't have survived. Like, we wouldn't have planned at 83 years old a full quadruple bypass, because you probably wouldn't have been able to handle it. But they saw so many collateral vessels. His right coronary was completely gone. And it was, the whole area was filled with these collateral vessels that were feeding his lungs and other areas. So you might think, well, how in the world did this develop anyway? If I'm exercising, it doesn't always, it depends sometimes on your genetics, right? It doesn't always completely prevent it, but you can stall progression of disease, and you can prime yourself to be a surgical candidate when the time comes.
Yeah, because we call it ischemic. So ischemia is lack of blood flow to an organ, preconditioning. So the lucky folks that develop these collaterals in their heart arteries after they narrow. So a lot of times, at least as the way I think about it, the poor person that's out running that just drops dead. They have an MI, and they, for whatever reason, the plaque ruptured, it blocked the artery. They have no ischemic preconditioning, and they die. And these folks that have narrowing, but not a lot of symptoms, but so they've had they've kind of created these collaterals potentially that ultimately save their life when the event happens. And it's the same thing in folks that have chronic heart disease. They develop the collaterals, and kudos to the surgeon for operating on an 83-year-old. A lot of times they won't do that. So
no, we even had a 90-year-old successful quadruple bypass, and he's doing great. But the key is, as you said, what saved him was really the exercise. And coming up next, right here on The Heart of Innovation, we're going to have more with Dr. Phillips and myself talking about the extent to which doctors save life and limb. So stay with us right here on KDOW. Don't go away.
Your type of condition is called critical limb ischemia. It's the most advanced form of P.A.D. or peripheral arterial disease.
Every 4 minutes, there is an amputation in this country due to P.A.D. and diabetes. We also know that 85% of these amputations are preventable with early intervention.
It's a flip of the coin. Patient prognosis is tied to whether or not they are referred to a true expert in the management of peripheral arterial disease.
Do you know if your physician is an experienced CLI operator?
When you're in the hospital dealing with doctors and stuff, you figure they know what they're talking about.
The skill level varies doctor from doctor and hospital to hospital.
Patients with limb threat are in constant fear. The depression that someone experiences after they lose a limb is equivalent to those of losing their spouse of 40 years.
I was stuck in a wheelchair close to 2 years and my husband had to quit work.
I didn't know what to do at this point because we had had nothing but infections and hospital stays and infections and hospital stays.
And they took one toe, another toe, and then it was another toe, and then half his foot before he was even diagnosed with P.A.D.
And all I heard was, "What are we doing here? Just cut it off." And I pulled the curtain back like, "Are you kidding me?"
Do you really want to go through all that?
That's crazy. That's insane. The protocol is to send them to amputation. Always, always, always get multiple opinions.
We do have options.
We need to listen more to our patients.
If you're going to chop off their leg anyway, why not just let someone else try?
This is the progression. First comes the wounds, and then comes an amputation. And I wasn't going to accept that.
So that's what it's like to try to save a leg.
Welcome back, everybody. Thanks for joining us. Thanks for listening in as Kim and I wax poetically on various things as it pertains to life and health and just emotional topics, really. And you shared with us, Kim, during the break that you lost a good friend that happens to be an actor and in the public eye. Do you want to?
Yeah, I just want to send my thoughts, my prayers, everything out, send so much love to the family of Patrick Muldoon. Patrick died literally the morning I was coming back from Italy. I got a message from a friend of mine who knows that I knew Patrick, and Patrick was near and dear to my heart. I did a story on him when I was at Forbes magazine. I had interviewed Kevin Costner, the actor, and he was getting into music. And I was curious about other actors that were getting into music. And, Patrick, you might remember him from Days of Our Lives and Melrose Place, Starship Troopers, many Hallmark movies to date. Even the other day, I saw him on a Hallmark movie. And I met him when I hosted the red carpet for Star Wars Revenge of the Sith. And he was one of the celebrities to show up for that. And so I was able to follow up with him and do a story, for Forbes magazine and the Video Network on him. But he ended up out of the blue. So many great things going for him. He passed away on Sunday. His girlfriend, not Denise Richards, she was a good friend. It was his real girlfriend. Can't believe the tabloids. She found him on the floor outside the shower. And we don't know the story. They say it's an alleged heart attack. He was a really good human on this planet. I will tell you, he's a really good friend to so many. His heart's in the right place. A mutual friend, Karen, she wrote 10 Things I Hate About You, The Ugly Truth, Legally Blonde. She's become a good friend through this whole, experience with him. And they've been best friends, and she's a good human too. And so, my heart goes out to Karen, his family, his girlfriend, his good friend, Denise Richards, and everyone. And it just goes to show, please get your heart checked. We don't know if it's his heart, but really pay attention to your cardiovascular and vascular health. And as Dr. John says, exercise, 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 and give yourself the best chance to live a longer, healthier life.
Yeah, well said. My condolences as well. It's just hard when you lose somebody suddenly. They're there one moment and then gone the next, and it doesn't really make any sense to us. And we talk about faith a lot sometimes on the show here, and I guess there's a plan out there that you may not understand or agree with, but I hope that there's some good that can come of it. But yeah, I get your heart, go to the doctor, get a checkup. exercise?
Ask questions.
Ask
Ask
questions.
lots of
Speaking
questions.
of questions.
I was just going to say, great segue. Great minds think alike. Let's go to Douglas. Douglas, go ahead and unmute and ask your question of, I believe it would be of Dr. John.
This question kind of goes for both of y'all. With between older doctors, newer doctors, the different cultures, the ER and outpatient services, can you tell a difference in how maybe what the doctors are learned or how they're trained and how they operate and work together or with their patients?
That is you just pulled a pin on a hand grenade there, Douglas. Thank you. Just make sure you keep it contained, right? We can put the pin back in. No, honestly, there's a lot to unpack there, but the way I kind of look at it is the quote older physicians, they have in theory more experience. If you haven't had a complication, you haven't been doing it long enough. And so the hope is that you learn from your complications, you grow, you continue to be curious in the field and go to conferences and try to learn new things and try to stay up to date with the new clinical research. Sometimes I'm guilty of this as well. I can sometimes get stuck in my own ways, and so you have to be able to be progressive and think outside the box. So, everybody's a little bit different, but the newer doctors, I think in general, are sometimes, because they're eager, they're learning some of the newer techniques maybe and more apt to adapt these.
Yeah. So we always say, don't look at age, don't look at title, don't look at even department title, don't look at facility, really look at their practical skill sets. And coming up next right here on the Heart of Innovation, more questions from our live studio audience. So stay with us.
I think it's pretty clear that there is value to the exercise therapy. And what we're seeing is that it's also, we're focused on P.A.D. here, but it's not just about P.A.D. These kind of exercise therapy programs have been shown to have an immense impact on cancer care. Not just people going through cancer surgery as prehab and rehab afterwards, but even if patients are just not getting any surgery and they're going through chemotherapy. We see it having an impact in some of our other areas of vascular care before aneurysm surgery. We see it in orthopedic conditions, thoracic surgical conditions, and so on. So I think we're learning as a field that there probably is a much bigger application for exercise therapy than we really appreciated.
Welcome back, everybody. Real short segment here. So we've got a couple of questions from our live audience. Hines, you are unmuted. What's going on, man? Nice background, by the way. I love the mountains.
Thanks, Dr. Phillips. Question, you keep mentioning, and other doctors mention about needles and wires and all that, but what do they really look like? And when you're going in plaque, are you using them to really poke into things, or I'll let you go further with that?
Yeah. Imagine like your drain is plugged, right? And so you obviously sometimes get that snake thing down there, or there's that one thing, that plastic thing that has a little teeth on it. You got to jam it in there. That's really what you're doing. So you're trying to get into what we call the lumen, or the opening from which in the vessel where the blood flows. And so you try to poke through the blockage. Sometimes they're very, very hard and calcified. And then, the artery has 3 layers. You can sometimes poke into one of the layers in between, or get between 2 layers, and then you kind of poke back into the actual lumen itself. And so the wires and then the catheters, which are just kind of smaller tubes, we'll use those as support. And the wires themselves, we are measured in thickness in inches. So the tiniest one that we have typically is 0.014 inches in diameter. So pretty small, like the size of a couple of strands of hair put together. And then the biggest one is 0.035. We don't really use that to typically poke through vessels. Sometimes we do, but below the knee, we're using the smaller ones. So yeah, you need a wire to pop through, and then do whatever you can to open that vessel up and get some blood flow. Save the piggies.
I love that question. I love there are 2 really loaded questions that we could spend an entire show talking about. But we did have an episode at youtube.com/the @ the way to my heart with, if you recall, on P.A.D Awareness Day in February, 3rd Saturday in February, that we did have Dr. David Dexter, and you led him to give us a tour of the cath lab and to demonstrate some of the devices. that were out there. So it might be worth going back and checking that out. But also, it might be interesting to bring on a few device companies that have some of these different tools that we can just show, and then we can drive our KDOW audience to the YouTube channel to watch online as well.
Excellent. Look, you're a true professional. True professional.
Thanks so much, Dr. Phillips. Thanks, everyone, for joining us. Excited about next week's episode, and we have so many great ones to come. You got to make sure to tune in. Next week, we have Dr. Kevin Lurie and Dr. Amer El-Sergani from Hawaii and Alaska. Dr. Lurie is a P.A.D. doctor with P.A.D. that has actually been treated with the reflow retractable stent. So you'll want to stay tuned next week to hear his story. So thanks, everyone, for joining us. Make sure to subscribe to our channel online and tune in next week.